Good morning. My name is Ravdeep, and today I am going to be doing the prenatal education / healthy pregnancy video. Before I would begin, I would knock on my patient's door. I would pull the curtain for privacy, and then I would introduce myself to the patient and do hand hygiene. And good morning, Miss Gloria. My name is Ravdeep. I am your nurse for today. Before we begin anything, can I please have you confirm your name and date of birth? Okay, and do you have any allergies that we need to be aware of? Okay, sounds good. So Dr. Smith did inform me you are 3 weeks pregnant. Congratulations. The purpose of our visit today is to go over some important knowledge that you need to be aware of in order to have a healthy pregnancy. Do you have any questions before we begin? Okay, so we can start. So you will be seen by your provider every 4 weeks till you reach the 28-week mark. After you reach the 28-week mark, you will be seen by your provider bi-weekly, so every 2 weeks. And then once you reach 36 weeks, you will be asked to see your provider once a week until you give birth. And now going into these OB visits that will be done throughout your pregnancy. At your initial prenatal visit, we will be doing a full head to toe physical exam, a thorough medical history assessment to see if there are any potential genetic disorders that could be passed on. We will also be doing a blood test to test the Rh factor, immunity, infections. And during the prenatal visit, we will also be calculating the due date for your delivery. And during the second trimester is when we will be doing ultrasounds to see the baby's position, to check the baby's growth as well as organs. We will also be measuring the fundal height, fetal heart rate, vital signs for both fetus and mother throughout the pregnancy. During the second trimester, we will also be doing something that is called a glucose test screening, which is done to test for gestational diabetes. And another test that will be done, so for the third trimester, a test that will be done includes a Strep B test as well as STD testing, which tests for potential infections such as STD that could be transmitted to the fetus during delivery. It is important for you to regularly attend these appointments as potential complications or concerns that could arise throughout the pregnancy are addressed in a timely manner. Now moving on to dietary intake, it is important for you to watch your dietary intake and avoiding certain foods such as raw and uncooked meat, such as seafood, as this can increase the risk of infection. It is important to avoid unpasteurized dairy products such as raw milk, raw cheese, as this can harbor salmonella, the bacteria such as salmonella and E. coli, which can also increase the risk of infection. We recommend that you increase your fruit and your veggie intake. It is recommended that you also opt for lean proteins and whole grains, as well as increasing your intake of supplements such as folic acid to prevent neural tube defects, vitamin C to aid in developing the baby's bones and preventing hypocalcemia for yourself, and iron through the form of green leafy vegetables such as broccoli and spinach to prevent anemia. And now moving on to physical activity, it is highly recommended that pregnant women participate in at least 30 minutes of daily exercise, and this could include cycling, walking, and swimming. It is encouraged to avoid high contact sports such as football, soccer, and basketball, as this can increase the risk of injury. And now moving on to healthy weight gain, which tends to be a touchy subject during pregnancy for some women. So depending on what your BMI is at your initial prenatal visit, you will be advised of your recommended healthy weight gain according to your BMI. So for example, if you are underweight, meaning if your BMI is under 18.5, it is recommended that you gain anywhere from 28 to 40 pounds. If you have a normal BMI, which is 18.5 to 25.5, it is recommended that you gain anywhere from 25 to 35 pounds. If you are overweight, So if your BMI is anywhere between 25.5 to 30, it is recommended that you gain anywhere from 15 to 25 pounds. And then if you are obese, meaning if your BMI is over 30, it is recommended that you keep your weight gain limited between 11 to 20 pounds. And now moving on to common complaints during pregnancy. So nausea and vomiting is a common one that we see, especially during the first trimester. It is recommended that you consume small, frequent meals throughout the day and avoid going long periods of time without eating. A second complaint that we see a lot also during the first trimester is increased urination. So having to urinate throughout the day. It is recommended that once you feel the urge to urinate, you do use the restroom and you urinate right away. It is also recommended that you decrease your fluid intake before bedtime to prevent disruption to your sleep schedule. The third complaint that we see throughout pregnancy is fatigue. It is recommended that you take often rest breaks when needed, you avoid taking on a heavy workload, and you stay hydrated. And now as for the top 3 concerns or complications that you may face, and we generally recommend to contact your provider or to visit the hospital and seek treatment, is number 1, if you are having heavy bleeding, specifically bright red bleeding, with specifically with clots, it is recommended that you contact your provider right away, and you also visit your emergency department for a follow-up, as this can indicate a hemorrhage or a potential miscarriage. The second complication that we recommend you to contact your provider right away for is blurred vision, and this can blurred vision slash extreme headaches, which can go hand in hand. And we recommend you to contact your provider right away, as this can indicate severe gestational diabetes as well as severe hypertension. So it is recommended that you get treated right away. And the third complication that we recommend for you to urgently address with your provider or with your local urgent care is decreased fetal movement. So especially if you are in the 3rd trimester and you are not feeling the baby kick as often, or it's been a while since you have felt any movement, we strongly urge you to contact your provider, as this could indicate a potential miscarriage or even fetal death. And that concludes our prenatal education, and well as some of the tips that I provided today in order to have a healthy pregnancy. I know it was a lot of information to take in. We will be providing you with a pamphlet today that has all the information that we discussed. If you go home and you have any questions that come up or any concerns, you're more than welcome to call our office and we will address that with you. As for now, I will follow up with your provider and I will book you out, and we will see you at your next visit. Thank you.